Hello, my name is Nicholas. I'll be your nurse today.
Hi, Nicholas.
Before we get started, I'm going to go ahead and do hand hygiene. I'm
Okay.
also going to close the curtain for privacy.
Okay.
I have all my equipment set up right here for us, so we're good to go.
All right, awesome.
May I go ahead and take a look at your wrist? Can I have your name and date of birth, please?
Trevor Stengel, 1596.
Beautiful. And what brings you in today?
My wrist hurts.
Your wrist hurts? Okay. And we are just going to do a quick bedside assessment for you. Your dress, your posture and demeanor are all normal. Your dress is appropriate, your demeanor is calm, and your posture is normal. So with your wrist pain, when did this begin?
2 days ago.
Perfect. And on what part of your wrist? Do you mind showing me?
Yeah, like right here.
Your outer wrist? Okay, great. And what are aggravating factors for you? Do you do anything to make it hurt more?
No.
What do you do to make it hurt less?
Sometimes I ice it.
You ice it? Okay, great. Perfect. What kind of pain is it? Is it throbbing pain? Is it sharp pain?
Throbbing.
Is it dull pain? It's throbbing pain. Okay, great. And what, do you have any pain related to it? Like, does anything else hurt because of it?
Nope.
Alrighty. And do you have any treatments for it?
No, I don't.
Okay. You don't take any medication or anything like that?
No.
Alrighty. On a pain scale of 1 to 10, what would you rate it as?
I rate it
1
as
being
a
the
6.
lowest, 10 being the
Like a
highest.
6.
A 6? Okay, great. And do you have any allergies I should be aware of?
I don't.
Alright, at this point, I'm going to go ahead and take your vital signs. I'm going to take your heart rate. I'm going to take your blood pressure. I'm going to take your temperature. I'm also going to take your respiratory rate. So your heart rate, is about 60 beats per minute. Your respiratory rate is 12. Blood pressure is 120 over 80. And your temperature is 98.8. Perfect. Everything checks out normal. I'm going to go ahead and ask you, how is your sleep pattern like? Are you sleeping about 6 to 8 hours a night?
Yes.
Okay, great. And do you have any stressors in life?
No, I don't.
No stressors? Any anxiety?
No.
Perfect. And who are your support systems?
Right now, I don't have a support system.
No support systems? Okay, great. I'm going to go ahead and examine your head now. Do you have have you had any headaches or dizziness recently?
No.
No? Okay. I'm going to go ahead and look at your scalp right now. Characteristics look good. No lice, dandruff, and it's all symmetrical. Great. All right. And now I'm going to go ahead and take a look at your eyes. Have you had any visual changes at all? Any impairments? Do you wear glasses or contacts?
Nope.
Okay, I'm going to go ahead and check your 6 cardinal fields. So you can go ahead and just follow my pen for me. Great. I'm going to go ahead and check cranial nerve number 3. You just follow my pen. Perfect. Alrighty. And then I'm going to go ahead and just check your optic nerve, cranial nerve number 2. So if you can go ahead and just look into the light for me. Great. Pupils dilate at a normal rate. They're all even. Do you have any hearing issues?
No, sir.
No hearing issues? Alright, cool. If you don't mind, I'm going to go ahead and just make sure. Tell me which side you hear this on.
Right side. Left side. Left side.
Perfect. Alright, your hearing is okay. Do you have any eating difficulties?
No.
Perfect. Your lips, go ahead and take a look at your lips. They look normal. Can you open your mouth for me? Teeth look good. Gums are nice and pink. Your mucosa looks good. Stick your tongue out for me. Move from side to side. Say ah. Great. Mouth looks all normal. And then can you go ahead and just swallow for me? Great, perfect. Let me go ahead and I'm going to go ahead and just inspect your trachea. Okay. Perfectly normal, symmetrical, no masses or anything. Great, at this point I'm going to like to go ahead and check out your lungs. Have you had any cough or phlegm? No, any shortness of breath, difficulty breathing? No? Great. If you don't mind, I would like to go ahead and look at and listen to your lungs. Take a big deep breath in for me. Exhale. Inhale. Exhale. One more time. Perfect. We can go ahead and check the side. Big Exhale. Perfect. And then go ahead and check your interior side. Big deep breath in. Big deep breath in. Big deep breath. One more time. Wonderful. Lungs sound good. All quadrants sound okay. No issues with that. I'm gonna go ahead and check your heart. Have you had any heart pains, palpitations, anything like that? No. Okay. At this point, I would like to go ahead and listen to your heart. I'll go ahead and check all the different types of valves. So first, I'm gonna go ahead and I'm gonna check your aortic valve. Let me check your pulmonic. Go ahead and check Earth's point, mitral, and tricuspid. Perfect. All sound appropriate. All okay. No issues with that. At this point, I'm going to go ahead and check your abdomen. When was the last time you had a bowel movement?
2 hours ago.
2 hours ago. And what does your diet look like?
I eat healthy. I don't eat a whole lot of meat, but I eat some red meat, some white meat, and fish. And then I eat vegetables and carbs.
Alrighty, great, perfect. Have you had any issues with diarrhea, constipation?
No, I have not.
Any issues urinating?
Nope.
Any urinary incontinence?
Nope.
Perfect. If you don't mind, I'd like to go ahead and listen to your to all 4 quadrants of your stomach. So I'm going to go ahead and I'm going to start on your right upper quadrant. Great. I'm going to check your left upper quadrant. Perfect. Right upper or right lower quadrant and left lower quadrant. Perfect. All sound good. No hypoactive or hyperactive sounds. At this point, I would like to go ahead and just palpate each quadrant to make sure everything feels okay. Let me know if you feel any pain at all. Perfect. No guarding, no pain. Alrighty. At this point, I'd like to go ahead and take a look at your skin. Do you have any incisions, cuts, any rashes, anything of that sort? No? Okay, so let me go ahead and feel. So your skin looks good, moisture is intact, moisture is perfect, no excess sweating, skin characteristics are normal, gray skin color, no edema, hair is normal. Let me go ahead and just check your cap refill. Perfect. Let me go ahead and check this side. Perfect. Both are less than 3 seconds. Let me go ahead and look at the lower extremities. Perfect. Less than 3 seconds on the lower extremities. At this point, I'd like to go ahead and check your pulses. I'm going to go ahead and check your radial pulse. Perfect. Let me go ahead and look at your brachial pulse on your left side. Great. Check it on the right side, the radial pulse on the right side. Check the brachial pulse on the left side, or right side. And then check check on the back of the knee, on the left side, and check on the back of the knee on the right side. Perfect. I'm gonna check the posterior pedis pulse. Perfect. All pulses seem normal. No throbbing, no dysrhythmias, anything of that sort. At this point, I would like to go ahead and check your musculoskeletal. I'm not going to check the right side because of your wrist hurting, or your left side because of your wrist, but I'm going to go ahead and check the right side. So you can go ahead and push up for me. Pull down. You can go ahead and close your arm like this and then push out for me. Push in for me. Great. And if you press up on your knee for me, and the lower extremities, push down. Pull down for me. Pull down for me. Great. And then push out for me on your lower. Push in. Great. Push out. Push in. Push up on your foot for me. Push down on your foot for me. Push up on your foot for me. Push down on your foot for me. Alrighty, all musculoskeletals, range of motion are intact. I did not check the left side due to the left upper extremity due to the wrist pain. Let me just ask you a couple questions about your musculoskeletal. What is your activity level like?
I exercise about 5 times a week.
Okay, perfect. And do you have any joint deformities?
No.
No joint deformities. Any pain in any of your other joints?
Nope.
Alrighty, perfect. Sounds great to me. At this point, I'm just gonna go ahead and step away, call the provider, and let them know what's going on. Thank you very much, Mr. Stengel, for your time.
Thank you, Dr. Stengel.
All right. Ring, ring. Hello, this is Nicholas Stengel calling from room 483 at Montgomery College. I'm referring to Trevor Stengel. He has arrived to the hospital with wrist pain. His everything checks out. All his vital signs are normal. Temperature's normal. Heart rate's normal. He does have a pain level of 6 out of 10. I would like to recommend some pain medication to alleviate the pain and maybe a wrist X-ray. All right, perfect. Thank you, Dr. Montgomery. You would like to go ahead and get him started on some ibuprofen and get a wrist X-ray. We'll evaluate his pain within 15 to 20 minutes to see if the ibuprofen has worked. If not, we will try something else. Great, Dr. Montgomery. Thank you so much. Have a great day, and we'll get back to you in a little bit with the results. Hang up the phone, and thank you very much.